On the day of your elective caesarean section, we ask you to come into the hospital about 8 o'clock in the morning. You'll arrive through the main maternity entrance and go up to the first floor of the maternity unit and go to the observation unit, which is where you'll be admitted for your surgery. There you will meet your midwife, and you'll also meet the anaesthetic staff and potentially the theatre staff there before you go down to theatre. The ideal situation is for somebody to come in and have a normal delivery and have nice low risk care. But the reality for a lot of women, due to a variety of circumstances, is that doesn't always happen. A planned caesarean section is called an elective caesarean section, and it is essentially pre-planned. On the morning of your caesarean section, you get an antenatal check by your midwife. She'll palpate your tummy, listen to baby, and perform a set of basic observations. You'll then meet the anaesthetic staff who'll introduce themselves and explain the spinal procedure, which is the anaesthetic of preference, and they will then confirm that they're going to go ahead. There'll be 2 to 3 caesarean sections in a day. From first thing in the morning, they'll make a decision as to what caesarean section's going first. When it is time for you to go, you'll be asked to get changed into your gown, and your partner will also change into theatre clothes. You'll then be taken along to theatre along the corridor. You'll walk with your midwife and she'll take you to theatre and introduce you to all the theatre staff and the anaesthetic team that you'll already have met.
Sometimes when you come into theatre it seems like there's a lot of people about, but they're all there just to help you, help your baby, help your partner. So we have a surgical team and we have the midwifery team and we have an anaesthetic team as well. So that may seem like a lot of people, but we all are there just to focus on yourselves and to look after you and make your journey as safe as possible. And safety is our big aim within theatres. We'll ask you questions that you've been asked before, and we'll also do a surgical pause with the whole team prior to starting to deliver the baby, and that's just to make sure that everybody is aware of any special issues that you might have, and that everything, all the equipment's available that we're going to need.
Once you get to theatre, you'll be prepared for your spinal anaesthetic. You'll sit on the edge of the theatre table, facing the window of the theatre, and the anaesthetist will prepare you for that anaesthetic.
Our job is to kind of see the women before, explain them what's going to happen during their operation. First thing to happen would be there's a checklist, operating checklist that goes through, and once they're happy with that, the anaesthetist will place a cannula or a plastic tube in the back of the hand, just to kind of give them the fluids and medications and everything else. Following which, our colleague would plug them up for monitors, which is the ECG dots, blood pressure cuff on a clip on a finger, and then the woman is positioned for the actual spinal anaesthetic. We clean the back with some cold antiseptic solution. It's very cold because there's alcohol in it. The anaesthetist will come in and put a drape on the back, a sticky tape, just to keep everything else nice and clean. Once that is done, 2 injections are applied back to back. The first injection might feel like a sharp scratch and a sting, and then following which you feel a lot of pressure in your back. Once the injection is done, we take all the needles out, the drapes come out, we just lie you down on your back with a slight tilt to the left side so that the pressure of the baby will not drop the blood pressure after the spinal has been placed. It takes about 10 minutes for the actual spinal to kind of fully work. That is from mid-chest all the way down to the toes. The surgery takes anywhere between 45 minutes to an hour. Once we finish the operation, we get the women back onto their bed, get the baby skin to skin, and take them back to the observation.
Once baby is delivered, your midwife is waiting beside the surgeons and will receive the baby from the surgeons. Baby is checked in theatre and you're kept involved in that procedure at all times. You'll then be taken back to observation unit, and when you arrive in observation unit you will be greeted by the same midwives who admitted you, and they will perform a series of observations to make sure that you're safe and comfortable. Your spinal will start to wear off gradually when we're in observation unit, and they will advise you when you're ready to mobilise. This is usually within the kind of 4 to 6 hour period. You will also have a catheter in situ. It used to be that we used to keep the catheter in quite strictly for 24 hours post-surgery, post-spinal anaesthetic. However, we have reduced the time of that, and that catheter can come out as soon as you're mobile. So you'll spend your first night following your caesarean section in the maternity ward. The next day, We would hope by that point you'll have your catheter removed, you'll be thinking about going to the toilet by yourself, you'll be up mobilising gently by yourself round the room and maybe out of the room to get a cup of tea, etc. And by that point you may want to consider, if all is well and baby is feeding well and baby is not having any problems, then there's every expectation that you should be able to go home that day.
My role is to see the women on the postnatal ward, so after they've actually delivered their baby. They ask questions like, can they do hoovering, can they go up and down stairs, how do they put about pushing prams. Our aim is really just to make things easier for them, give them the confidence that they're going to manage once they get back home, and also give them gentle exercises to help them recover and get their muscles back nice and tight again. The exercises that we give are all very gentle exercises, and those exercises are there to get your pelvic floor muscles and your abdominal muscles starting to get stronger again, because they've all been weakened and stretched just with being pregnant. So we look at your pelvic floor muscles, getting them nice and tight again, and that is more to do with them making sure that you're getting good control of your bladder and your bowels and don't have any concerns further down the line with incontinence issues. Your abdominal muscles, we look at gentle exercises such as just knee rolling from one side to the other, pelvic tilts, and also small sit-up movement for your long muscles that go up and down. Going home, it's just really about just watching what you're doing, just listening to your body, and just taking things a little bit more easy. If there's people there to help, do the more strenuous tasks, get them to do that, and rest when you can rest as well.
The community midwife will come out to see them the day after they're discharged from hospital, so there'll be ongoing support from staff. We want our mums to go home feeling that they've had a positive experience. We want them to go home feeling that they've got adequate pain relief on board to go home and gently mobilise and care for their baby with a little bit of support from family and friends. We would like them to look back on their experience and feel that it was one that they had the information to deal with, and that they were well prepared for, and that information helped it be a positive experience.